Good afternoon, Miss. We are Group 4. Our members are Tabelsky, myself, Jamila Thomas, Whitney Bremner, Alicia Fuentes, Vanessa Khan, and Leah Branca.
Good afternoon, Miss. My name is Vanessa Khan, and I will be presenting research and planning. Healthcare is provided in dynamic, complicated, and ever-changing situations. Changes in medical treatments, reimbursement restrictions at the federal and state level, public awareness of individuals, and communal healthcare decisions all contribute to an increase in information demands to prepare for these developments and the increasing need for clinical information. Computer systems are being developed to collect, store, retrieve, analyze, and transmit health status and healthcare information. When informatic ideas are included in the system, it can help with the collection, storage, retrieval, and analysis of patient care data. Appropriately planned and implemented computerized information systems may convey patient care data into clinical, relevant, helpful information and knowledge. Next slide, please. The healthcare sector is one of the major consumer-oriented industries that potentially reap significant gain from the computerization. In recent years, a great number of health professionals and organizations have used electronic and information technology to improve healthcare delivered at many levels, including primary care, ambulatory care, and tertiary care. With modernization, all health hospitals will ultimately have adopted some type of patient healthcare information. Next slide, please. Benefits. Nursing informatics system provides several benefits, primarily by enhancing patient care, safety, and efficiency through the appropriate use of technology and data. These benefits may include the following: quicker access to patient data, reduces medical errors, improved data analysis, personalized care, evidence-based practice, virtual care support, and enhanced efficiency and workflow. Next slide, please. Downfall. Despite the benefits, nursing informatics systems have many disadvantages. These include insufficient data security, restriction system, interoperability, user-unfriendly interface that hinder productivity workflow, lack of nursing involvement, system quality, negative impacts on care delivery, lack of unified technology, resistant to change, and need for advanced education. Next slide, please. Consequences. While there are benefits to nursing informatics systems, such as better patient outcome, improved communication, more efficiency, and fewer errors, there are also possible drawbacks such as security breaches, data privacy concerns, implementation difficulties, and resistance to change. The need to know about analysis, the need to know about nurse information system in this day and age. I will now pass you on to my next colleague.
In today's highly digital healthcare environment, nurses all over the world are quickly expanding their knowledge and the use of computers and information sciences to help them more sophisticated and Because of the advent of nursing informatics, new roles for nurses are emerging in industry, research, system development, in nursing administration, as well as the reason that many nurses have ventured into the field of nursing informatics is a common vision of information systems being used to enhance the practice of nursing and to benefit the patient by extending and improving the health care received. Nursing informatics, or the science and practice of combining nursing knowledge and information with technology, is critical for efficient and successful healthcare delivery. Next slide. What would the NIS do? In order to manage and disseminate health information and eventually enhance patient care and results, a nursing informatics system combines both nursing expertise with information technology. It assists with a number of tasks such as gathering, storing, retrieving, analyzing, and computing data, guaranteeing the nurses and other medical professionals have quick access to information. Next slide. What will it anticipate best? It would help anticipate, make relevant patient data available in a usable form so patient care problems can be solved. Process information to support management functions, such as receiving data from departments and supplying data to various departments to make policy decisions, operating decisions, as well as patient care decisions. It provides a comprehensive automated information processing system for all phases of the nursing process, and it helps to develop care plans for families and patients. Next slide. These are some of the best methods for implementing an NIS. This includes care informatics, content in nursing curriculum, prepare nurses with specialized skills in informatics, enhance nursing practice and education through informatics projects, and to prepare nursing faculty in informatics to help increase collaborative efforts in nursing informatics. All these are some of the best methods to help implement. Next slide. And these are some of the challenges of implementing an NIS. Unfortunately, until recently, nursing as a profession was not fully involved in the selection, implementation, and decision-making process about which systems were suitable for institutions. And as a result, many of the older systems on the market and in hospitals did not meet nursing demands. These are some of the challenges. 1, it is difficult to bring nursing informatics into an organization without the staff in the organization accepting the impact of the change. 2, despite the benefits of nursing informatics, they are not generally employed in healthcare and have not been broadly embraced. This might be due to a lack of proper training and inability to educate the end user regarding the reasons of their adoption. 3, little study has been made to establish the cost benefits and the efficiency of information systems. Finally, further situations provide problems for nursing informatics and artificial intelligence. Next slide. And I'll hand you over to my next colleague.
Hi, good night. So for the needs assessment, you all see me, right? All right. To identify the issues of the NIS in Trinidad and Tobago, we will gather information from the nurse managers and physicians, IT staff, medical record staff, and hospital administration. Through surveys, interviews, focus groups, work for observations to understand the daily operations, challenges, and goals of the system. Right, so this is our identification of needs and problems. So firstly, we have the extended wait time for reports. So the patient must wait a long time for tests or lab findings. So it could be frustration, missed follow-ups, and overcrowded clinic in areas results from this. Second, we have the manual procedures. So the majority of communication and documentation is done manually, which raises the possibility of mistakes, duplications, and it is time-consuming. The absence of audit trail. So who made a request, when it was made, and when it was fulfilled, are all unclearly documented. So accountability is diminished as a result. Issues with timelines and accuracy. Clinical choices may be directly impacted by transcription errors and data availability delays caused by manual procedures. The impact of patient care. So treatment will be delayed. You might have inadequate care. Decreased patient satisfaction are caused by outdated processes and poor information flow. Next slide. So this is some of the benefits of implementing the NIS. So the management of labs and reports. So you will minimize manual handling and quicker, more dependable access to patient test data. The automation of workflow is the streamlined clinical procedures using digital notes and standardized forms. Responsibility, transparency, and accountability are enhanced with a complete audit trail of all user actions. The data precision. Data records boost clinical data confidence and decrease human error. And improved medical attention is that healthcare professionals can provide better care when they have access to timely, coordinated information. Next slide, please. So these are some issues and strategies for the mitigation of the NIS system. So firstly, we have the opposition to change. So to counteract that, you train employees, involve them in system design, and implement the system gradually. The limitations of infrastructure, you could boost network performance and guarantee device availability. Costly, you could implement gradually, and you could look for the government or a partner for funding. And the needs for training, provide workshops on digital literacy and designate a super user in the department. A super user can perform virtually any action on the system, including modifying system configurations, installing software, and managing user accounts. Right, next slide. So there's some key features of the NIS required in Trinidad and Tobago. So firstly, we have the management of orders and results electronically. So by this, you order digital tests, the notifications will come at real time, the integration of the lab. Right? The portal for patient reports, it is online and safe access to the reports. You can even get it on your email or SMS alerts. The logs for all user activity and audit trail, it keeps track of every staff action on the system, who, what, and when they're on the system. The clinical documentation standardization, nurses' notes, vitals, and intervention templates will be easier to fill out and it will be less time consuming. Access on the go, you could use tablets, your smartphones to access the information remotely or in clinics as well. Combing the national systems, it will be compliant with Ministry of Health guidelines and other hospital systems. Management of patient and queue flow, check flow, is your tracking the wait times with digital check-in, and when they see the doctor and receive the meds and whatnot. So you have a time frame. The automated reminders and alerts, medication, vaccination notifications and follow-up will be set on your phone, tablet, even a laptop, so you won't miss any of them appointments. And tools for reporting and quality monitoring, clinical metrics, incident and compliance dashboards. We have that. So, next slide. So I'll pass on to my other colleague who will do design and development.
Design and development. So here we have some key features to ensure the nursing information system is functional. And these include the electronic charting of vital signs, assessments, and nurses' notes. We also have care plans and interventions tracking, integration with pharmacy systems for real-time updates on medication orders, barcode medication administration, allergies and contraindication alerts, assignment and tracking of nursing tasks and to-dos, reminders for time-sensitive actions, radiology orders and report access notification when radiology imaging is completed or delayed, and flagging of critical results. Next slide, please. Some more key features include role-based access control, audit trails, encryption, and adherence to the HIPAA or local regulations. It meets Trinidad and Tobago's Data Protection Act, nurse-to-nurse shift reporting, messaging with physicians or departments, and last but not least, alert notification for new orders or patient deterioration. Next slide, please. So here we have a nursing information system architecture flow. So firstly, the nurse will log into the nursing information system dashboard using a mobile device and their staff ID information. Next, the system will fetch patients' assignments via the hospital information system with the task to be prioritized first. Next, the nurse reviews vital signs and documents care done for the patient. Next, the nursing information system pulls medication lists from the pharmacy system. The nurse then scans medication and patient ID for verification. Next, the data is recorded in the nursing information system and sent to the electronic medical record. Then alerts are generated if any vital signs are critical. And finally, an electronic shift report would be completed for the next nurse. I will now pass you on to my colleague.
Testing and implementation. This is a vital phase when transitioning to another platform, ensuring functionality and suitability to effectively serve the needs of the organization with minimal disruptions, if any. There are 4 methodologies in which this is possible, namely direct cutover, pilot, implementation, parallel operation, and phased implementation. Direct cutover. Installation of a new system on a specific date to commence operation while discontinuing an existing or old system. Pilot implementation. A small group within the organization is recruited to initially operate the program prior to its full introduction. Parallel operation. New and existing systems are operating together. This avoids any downtime while allowing trial of the incoming system. Phased implementation. The transition is successive, providing features of the new system are functional. It is safe to disable those which are similar in the old system. Right, so each implementation system will have advantages and corresponding disadvantages. So in direct cutover, the advantages are that it is quick and cost effective. The disadvantages, however, it is extremely risky if glitches occur. Staff may lack readiness to operate new program. No buffers are in place. And finally, it does not allow for training on a new program. Pilot implementation. Advantages. New system permits the time for staff training. Its impact is minimal as is contained or managed within a subgroup. And finally, rather than having to direct all staff, the support team can exercise control over a smaller group. Disadvantages. It is slower to take effect. Multiple systems create confusion because they have both the old and the new system operating together, and backup is unavailable for the new system. Parallel operation. Advantages. It ensures continuity of operations and it is low risk. Disadvantages, however, it is costly and time consuming. And finally, phased implementation. Control is maintained and it is low risk. These are the advantages, and the disadvantages. It is time consuming and it may not be compatible. Right. Staff training for effective system use. The pilot implementation model was chosen over other models as training can be undertaken by a group who can then teach other colleagues. This minimizes any opportunity for disruptions in service delivery to the public should all staff be trained at the same time. Using this system, participants are representative of the general population rather than selected arbitrarily. So staff from each department, for example, maternity, pediatrics, surgical, etc., would undergo training to learn the new nursing information system. It would afford the subgroup an opportunity to navigate the system firsthand in order to discover areas that are user-friendly and others challenging, which may require review. Trainees can thus supply feedback for making improvements, not only on the simulation, but to effectively suit the live environment. For maximum participation, staff can be rostered according to schedule to facilitate training. To determine a fruitful outcome, access to the learning environment can encompass both physical and virtual options based on resource availability, with facilitators being present to provide support and guidance, answering questions and troubleshooting where necessary. Recommendations for training staff.
Just now. Right, we go start it over, right?